Hey everyone, and welcome back for another deep dive. You know how this works. You give us the source material, we roll up our sleeves and pull out all those golden nuggets of knowledge just for you.
That's right. We do all the heavy lifting.
Exactly. And today we are focusing on a topic that is super important for, well, anyone who has ever had a period, vaginal bleeding.
Yes.
But specifically, how to tell if it's normal, no worries, or if it might be a sign that something else is going on.
Yeah.
And to guide us on this deep dive, we have two excellent guides from the Merck manuals. One is a quick overview, and the other is, well, it goes a little bit more in depth. So are you ready to jump in?
Absolutely. Let's get into it.
I am really excited about this one because, honestly, knowledge about our own bodies is
I
power.
100% agree.
Okay, so first things first. What exactly is vaginal bleeding? I know it sounds basic,
Yeah.
but it's a good place to start, right?
Always good to start with the fundamentals. Basically, it's just the passage of blood from the vagina. But here's the key. It's not always a reason to freak out. We all know about periods.
Exactly. And the Merck manuals actually emphasize that menstruation, a period, is a totally natural form of vaginal bleeding.
Right.
And they lay out the typical time frame. It usually happens every 21 to 35 days. But for teenagers, it can be anywhere up to 45 days.
Wow.
And those periods themselves, they usually last about 3 to 7 days.
And actually, it's fascinating how our bodies are designed even from the very beginning, because the Merck manuals point out that newborn baby girls, they might have a little bit of vaginal bleeding for up to 2 weeks after they're born.
Really?
Which is totally normal, but if it goes on longer than that, it's probably a good idea to have a doctor take a look.
It's like our bodies are giving us these little clues right from day one. Okay, so we've established that sometimes bleeding is, like, expected. But both of our Merck sources, they make a big deal about understanding what's abnormal when it comes to bleeding. Why is that difference so important?
Because abnormal vaginal bleeding can be like a big red flag. It's basically saying, hey, something else might be going on here. It could be something as simple as a hormonal imbalance, or it could be something like an infection, or even in some cases, something more serious like cancer. So paying attention to those signals, it's really important.
Yeah, it makes total sense. It's like our bodies have this internal communication system, and we need to learn how to decode the messages.
Exactly.
So let's talk about what actually makes bleeding abnormal.
Yeah.
The Merck manuals give some really clear examples. So bleeding before you even get your first period, or bleeding between periods, those are definitely red flags.
Right. And bleeding during pregnancy or after menopause, that's also considered abnormal.
And even during your period, there can be signs that something's a little off.
Yeah.
Like if it lasts longer than 7 days. Or if it's so heavy that you're changing pads or tampons every hour. Or if it's coming way more often or way less often than usual. Those are all things to, pay attention to.
Absolutely. And that's where things can get a little more serious, because no matter what the cause is, if the bleeding is heavy or goes on for a long time, it can lead to iron deficiency anemia. That feeling of being completely drained, like you just ran a marathon, even though you haven't left the couch.
Oh, yeah.
That's what anemia can feel like.
Yeah, not fun.
Yeah, and it's really important to remember that in some cases, sudden and very heavy blood loss can actually lead to shock, which is a serious medical emergency, and that's when you absolutely have to seek immediate medical attention.
No waiting.
Straight to the doctor, no waiting.
Wow. It's definitely a good reminder to just trust our gut, get help if something feels seriously wrong. And, the Merck manuals point out something that I found really interesting. The potential causes of abnormal bleeding can actually change depending on your age.
It's true. It's almost like our bodies go through all these different phases, and each phase has its own set of possibilities, things to look out for.
That makes sense. Okay, so let's break it down by age group. What are we looking at when it comes to young girls?
Okay, so with little girls, vaginal bleeding, it could be caused by something as simple as an injury. Or maybe they're curious and they got a small object stuck up there,
Oh, yeah.
like a piece of toilet paper or a small toy.
Sounds about right.
For girls under 8, it's possible that early puberty could be the cause. And of course, we also have to consider the possibility of sexual abuse, which is a serious issue that needs to be addressed with, sensitivity and care.
Yeah, absolutely. It should never be overlooked. Okay, so moving on to teenagers who are just starting to get their periods and women approaching menopause.
So in these stages, the most common culprit behind abnormal bleeding is fluctuating hormones.
Makes sense.
It's like our bodies are on these hormonal roller coasters,
Hmm.
especially during puberty and menopause, and those ups and downs can definitely impact bleeding patterns.
Yeah, so much is going on during those times. Then for young and middle-aged women who are in their childbearing years, we have a whole other set of possibilities.
Absolutely. In this age group, we see things like pregnancy complications, fibroids, and even spotting from birth control pills. It can be worrisome, but often they're very treatable.
Okay, that is reassuring. Okay, last but not least, what about older women who are past menopause?
So this is a group that needs to be extra vigilant. Any bleeding after menopause is considered abnormal and needs to be checked out by a doctor. It could be something as simple as thinning of the vaginal or uterine lining, which is common after menopause. But it's important to rule out other possibilities too.
So even though thinning lining might be the most common cause in this age group, you're saying it's still important to get it checked out just in case.
Exactly. It's always better to err on the side of caution. Early detection is key for so many health issues, and that's especially true when it comes to something like cancer.
Okay, so we've covered a lot of potential causes for abnormal bleeding across different age groups.
Yeah.
But what about knowing when you actually need to see a doctor?
Right.
Like, what are the signs that you shouldn't wait, that you should seek medical attention right away?
Well, the Merck manuals actually give us a really helpful list of red flags that warrant a trip to the doctor ASAP. So things like feeling faint or weak, experiencing extremely heavy bleeding, or passing large blood clots.
Got it.
Those are all signs that something could be seriously wrong and you shouldn't wait to get help.
Okay, so if you're experiencing any of those, it's straight to the ER or urgent care, no hesitation.
Exactly. And even if you don't have those really intense warning signs, but something just feels off about your bleeding, always trust your instincts and reach out to your doctor. You know your body better than anyone else.
That is such a powerful message, to really trust ourselves and advocate for our own well-being.
Yeah.
Okay, so let's say you do decide to see a doctor for abnormal bleeding. What can you actually expect during that visit?
Well, the Merck manuals actually walk us through a typical doctor's visit for abnormal bleeding,
Yeah.
which I think can be really helpful for anyone who's feeling nervous or unsure.
Yeah, I love that. Let's talk about it. So first things first, what usually happens when you get to the doctor's office?
Well, they'll start by asking you a lot of questions about your bleeding, your overall health, and your typical menstrual cycle.
Oh, so it's kind of like a detective trying to gather clues.
Exactly. They're trying to piece together the puzzle of what might be causing your abnormal bleeding. So be prepared to talk about, when the bleeding started, how long it lasts, how heavy it is, and if it seems connected to anything else, like your cycle, sex, or any medications you might be taking.
So details are key.
Yes, details are key.
And they'll probably do a pelvic exam too, right?
Yes, a pelvic exam is usually a standard part of the evaluation.
I know some people feel a little anxious about pelvic exams,
Right.
but it sounds like it's really an important part of getting to the bottom of what's going on.
It really is. It allows the doctor to see if there are any visible abnormalities that could be contributing to the bleeding. And they might also do a pap test at the same time, which is a screening for cervical cancer.
So it's kind of like a two-for-one deal.
Exactly. They can get a lot of information from that one exam.
Okay, so we've talked about the questions, the pelvic exam. What happens next? Are there usually other tests involved?
Often, yes. Depending on your specific symptoms and what the doctor finds during the exam, they might recommend some additional tests.
Like what kind of tests?
Well, pregnancy test is usually the first step, especially for women who are in their childbearing years.
Even if they're pretty sure they're not pregnant.
Yes, it's just a precaution to rule out pregnancy as a potential cause of bleeding, even if it seems unlikely.
Okay, that makes sense. What other tests might be on the table?
Blood tests are also very common. They might check your blood count to see if you're anemic from blood loss, which is something we talked about earlier.
Right, makes sense.
And they might also check your thyroid hormone levels because thyroid problems can sometimes mess with your cycle and cause abnormal bleeding.
You got it.
And depending on what they suspect might be going on, they might also order tests to check your hormone levels or even tests to see how well your blood clots.
Wow, so many possibilities.
Yeah.
It sounds like they're really thorough in trying to pinpoint the cause. What about imaging tests? I know the Merck manuals mention ultrasounds.
Yes. Ultrasounds can be incredibly helpful. They use sound waves to create images of your reproductive organs, so it's a non-invasive way to get a peek inside and see what's going on. They can help identify things like fibroids, polyps, or cysts that could be causing the abnormal bleeding.
It's amazing how technology can give us that kind of insight into our own bodies.
Yeah.
So let's say the ultrasound does show something suspicious, like one of those fibroids or polyps you mentioned. What happens then?
In that case, the doctor might recommend a procedure called a hysteroscopy or a sonohysterography.
Okay, those sound pretty intense. What exactly are those procedures?
Well, they're basically ways to get an even closer look inside the uterus. For a hysteroscopy, they insert a thin, lighted tube through the vagina and cervix and into the uterus. It allows them to directly visualize the lining of the uterus and see what's going on.
Wow, that's pretty high tech.
It is, and sometimes they'll even take a small sample of tissue during a hysteroscopy, which is called a biopsy. They can examine that tissue under a microscope to check for any abnormalities, including cancer.
That makes sense.
Yeah.
Especially if they're concerned about something serious.
Exactly. A biopsy is the most accurate way to figure out if there are any cancerous cells present.
Okay, so we've talked about all the possible tests and procedures, which I have to admit can feel a bit overwhelming.
Yeah.
But what about treatment? What are some of the actual ways that abnormal bleeding can be addressed once they figure out what's causing it?
Well, the treatment really depends on the underlying cause. If it's something simple, like spotting from birth control pills, the doctor might just recommend tweaking the type of pill you're taking or adjusting the dosage.
That does sound pretty straightforward. But what if it's something more complex, like those fibroids or polyps we talked about?
If those are causing problems and impacting your quality of life, they might need to be surgically removed. But the good news is that there are minimally invasive surgical techniques available these days that can make the recovery process a lot easier.
That's good to know. And what about if it's a hormonal imbalance causing the bleeding? What are the options in that case?
If hormones are the culprit, hormone therapy might be the answer. This could involve something like birth control pills or other medications that can help regulate your hormone levels and get things back on track.
So it sounds like there's a whole spectrum of treatment options, from simple medication adjustments to more involved procedures. The important thing is to find what works best for you.
Absolutely. And that's why it's so crucial to have those open and honest conversations with your healthcare provider. They're there to help you navigate all of this and find the best approach for your individual needs.
I think that's a great takeaway for our listeners. You are not alone in this.
Definitely not.
There are resources available, there are answers, and there are solutions for abnormal vaginal bleeding. And knowledge is power. So the more we understand about our own bodies, the better equipped we are to advocate for our health.
I couldn't agree more. It's all about taking charge of our own well-being and feeling confident in making informed decisions about our health.
This has been such an eye-opening deep dive already. Thank you so much for breaking all this down for us.
It's been my pleasure. I'm always happy to share information and empower people to take control of their health.
And to our listeners, we hope you're finding this exploration of abnormal vaginal bleeding informative and empowering. Remember, paying attention to your body and advocating for your health is so important. And if something doesn't feel right, don't hesitate to reach out to your healthcare provider. We'll be back with part 2 of this deep dive, so stay tuned.
Welcome back to our deep dive into the fascinating world of vaginal bleeding.
I have to say, I'm already feeling so much more informed about, what's normal, what's not, when to get help. But now I'm curious to, dig even deeper into the specifics.
Let's do it. In part 1, we talked about the basics of abnormal bleeding and touched on some possible causes across different age groups.
Right.
But now it's time to get down to the nitty-gritty.
Yes. In our, deeper Merck manual dive, there's this whole table outlining specific causes. Let's unpack some of those, shall we?
Let's. And I think a perfect place to start is with those tricky hormones we keep talking about. The Merck manual specifically calls out ovulatory dysfunction as a common culprit during the childbearing years.
Ovulatory dysfunction. That sounds kind of intimidating. What exactly does that mean?
Don't worry, it's not as scary as it sounds. Basically, it means that ovulation, the release of an egg from the ovary, is either delayed or it doesn't happen at all.
Okay.
And that can really throw a wrench into your menstrual cycle.
So instead of those nice, predictable periods we talked about earlier, you might end up with irregular periods, bleeding between periods, or even super heavy periods.
Exactly. And what's interesting? This type of bleeding is more common in teens who are just starting their periods and women in their late 40s who are getting close to menopause.
Oh, it's interesting. So it's kind of like bookends to the whole childbearing experience.
Exactly. Though it can happen at any point before menopause, of course.
Yeah, that makes sense. The Merck manual also mentioned that a common cause of this hormonal imbalance is something called polycystic ovary syndrome, or PCOS.
Right. PCOS is a hormonal disorder that can lead to a whole cascade of changes in the body, including irregular periods, acne, excess hair growth, and even difficulty getting pregnant. It's something that definitely warrants attention and, proper management.
Okay, so we've got hormonal imbalances and PCOS as potential players in the abnormal bleeding game. What else jumps out at you from this Merck manual table?
Well, fibroids are another common cause, particularly during the childbearing years. You might be surprised to know that up to 80% of women will develop fibroids at some point in their lives.
Wow, 80%. That's a lot. Remind me, what exactly are fibroids?
Okay, so fibroids are these non-cancerous growths that develop in the uterus. They're basically clumps of muscle and fibrous tissue that can range in size from like tiny seeds to large grapefruits. Imagine that.
Oh, wow. Yeah, that's a pretty wild image. But I'm guessing they don't always cause problems, right?
Yeah. You're right. Sometimes they just hang out in there quietly, causing no symptoms whatsoever. But when they do act up, abnormal bleeding is often like a key sign. You might also experience pain, pressure, or a feeling of heaviness in your pelvic area.
I can imagine that wouldn't be very comfortable.
No,
I'm guessing the size of the fibroid probably has something to do with whether or not it's causing problems.
you're exactly right. Larger fibroids are more likely to cause symptoms, but even small ones can sometimes cause issues, especially if they're located in a spot that interferes with your menstrual flow or puts pressure on your bladder or rectum.
Okay, that makes sense. So fibroids are definitely something to be aware of. What about polyps? The Merck manual mentions those too.
Polyps are similar to fibroids in that they're growths, but they're soft and non-cancerous, and they develop on the cervix or inside the uterus.
Kind of like fibroids, but in a different location.
Exactly.
Got it.
And just like fibroids, polyps can cause abnormal bleeding. You might notice bleeding between periods or even bleeding after intercourse. It's all about paying attention to those patterns and changes.
Yeah, I'm starting to see a theme here. Our bodies are constantly giving us information, and it's up to us to be detectives and figure out what those messages mean.
Exactly. We need to be our own health advocates. And speaking of being detectives, the Merck manual calls out a really important point about abnormal bleeding during the childbearing years. Sometimes it's related to an unrecognized pregnancy.
Oh, wow, that's a really crucial point. So we're talking about complications like miscarriage or an ectopic pregnancy.
Yes, a miscarriage is the loss of a pregnancy before 20 weeks, which is incredibly difficult to go through.
Mm.
An ectopic pregnancy is when the fertilized egg implants outside of the uterus, usually in the fallopian tube. And both of these situations can cause abnormal vaginal bleeding, often along with like pelvic pain or cramping.
Yeah, it's heartbreaking to think about those possibilities. I imagine those are definitely situations where you'd want to seek immediate medical attention.
Absolutely, especially with an ectopic pregnancy, because it can be life-threatening if the fallopian tube ruptures. So anytime you have abnormal bleeding during pregnancy, it's crucial to get checked out right away.
It's like our bodies are sending up those red flags again, urging us to pay attention and seek help. So much of this information is about being aware and knowing when something isn't right.
I couldn't agree more. Knowledge really is power when it comes to our health. And speaking of different stages of life, we've talked a lot about the childbearing years. But what about after menopause? What are some of the causes of abnormal bleeding in that phase?
Well, remember how we talked about how any bleeding after menopause is considered abnormal and needs to be investigated?
Right.
So it could be due to something as simple as thinning of the vaginal or uterine lining
Right.
because of, the natural decline of estrogen after menopause.
Right. That's the most common cause. But we can't forget about polyps and fibroids.
Right.
They can still occur after menopause, although they're less common than during the childbearing years. And of course, we always have to consider the possibility of precancerous or cancerous lesions of the uterine lining.
Wow. So even though cancer isn't the most common cause of postmenopausal bleeding, it's still something that needs to be ruled out.
Absolutely. Early detection is key when it comes to cancer treatment.
Right.
The sooner we catch it, the better the chances of successful treatment and recovery.
It seems like a recurring theme with abnormal bleeding is that it's often a symptom of something else going on rather than a diagnosis in itself.
That's a great observation. It's like a flashing neon sign saying, hey, something needs attention here. And figuring out what that something is the key to getting the right treatment and feeling better.
That makes a lot of sense. It's like our bodies are these incredibly complex machines, and sometimes those machines need a little tune-up or repair.
Exactly. The Merck manual also mentions some less common causes of abnormal bleeding that can pop up at any age, regardless of where you are in life.
Oh, like what?
Well, there are bleeding disorders, for example, which can be caused by certain medications, liver problems, or even hereditary conditions.
So if someone has a history of, easy bruising, excessive bleeding after a small cut, or those tiny red or purple dots on their skin, that could be a sign of a bleeding disorder,
Exactly. Those are all red flags that warrant further investigation. And of course, we can't forget about the possibility of physical trauma.
which could be anything from, an accident to, sadly, sexual assault.
Right. It's important to be aware of that possibility as well. Trauma can definitely cause abnormal bleeding, and it's essential to seek medical attention and, emotional support in those situations.
Wow, we've covered so much ground already when it comes to, the potential causes of abnormal bleeding. I feel like a detective who's gathered all the clues and is ready to, solve the mystery.
You're doing great. But hold on tight because we're not done yet. There's still more to uncover in our abnormal bleeding investigation.
I can't wait. I'm ready for the next chapter. Join us for part 3 of this deep dive, where we'll explore what happens when you actually see a doctor for abnormal bleeding, the tests they might order, and the range of treatment options available. It's going to be fascinating. Welcome back to the deep dive. We spent the last 2 parts of this episode really getting into, the nitty-gritty of abnormal vaginal bleeding. What it is, the possible causes, and how those causes can differ depending on, your age and stage of life.
Right. We've covered so much ground already.
Yeah, it's like we've gone through this, crash course in abnormal bleeding detective work.
Absolutely.
I feel like I have a whole new level of awareness about, what my body might be trying to tell me. But now I'm thinking about that next step, what actually happens when you decide to go to the doctor about abnormal bleeding?
Right.
It can feel a little intimidating, to be honest.
I totally get that. Going to the doctor for anything can be nerve-wracking, especially something related to our reproductive health. It can bring up a lot of anxiety. But remember, your healthcare provider is there to help you.
That's true.
They want to understand what's going on and find the best way to address it.
That's a good reminder. The Merck manuals actually, they walk us through a typical doctor's visit for abnormal bleeding.
Yeah.
And I think that could be really helpful for anyone who's feeling nervous or unsure about what to expect.
Totally. Knowledge is power. Knowing what to expect can definitely help ease some of those anxieties.
Right.
So let's break down that doctor's visit step by step.
Okay, perfect. So you walk into the doctor's office, you've explained why you're there. What usually happens next?
Okay, so they'll usually start by asking you a lot of questions about your symptoms, your medical history, and your menstrual cycle. It's like they're piecing together a puzzle, trying to figure out what might be causing this abnormal bleeding.
So it sounds like it's really important to be as specific and detailed as possible when you're answering those questions.
You're absolutely right. The more information you can give them, the better.
Yeah.
The better equipped your doctor will be to understand what's going on. They'll want to know things like when the bleeding started, how long it lasts, how heavy it is, the color of the blood, whether you're passing any clots, and if it seems to be related to anything else like your period, if you're sexually active, or any medications you're taking.
But being a detective, right?
Yeah.
Gathering all the clues.
Exactly. And don't be afraid to share anything that seems relevant, even if it feels a bit embarrassing or like TMI. Your doctor has heard it all before. Trust me.
Okay, that's good to know. So after the question and answer session, what's next? I'm guessing a pelvic exam is probably on the agenda.
You guessed it. A pelvic exam is usually a standard part of the evaluation for abnormal bleeding. And it allows your doctor to visually examine your cervix and vaginal walls,
Right.
to see if there are any abnormalities that might be contributing to the bleeding.
Yeah, I know pelvic exams can be a bit uncomfortable,
Yeah.
but it sounds like they're a crucial part of the process.
They really are. They provide really valuable information that can help guide the next steps in your diagnosis and treatment plan.
Okay, so the doctor has asked all the questions. They've done the pelvic exam. What happens next? Are there usually, other tests involved at that point?
Oftentimes, yes.
Ugh.
Depending on your specific symptoms and what the doctor found during the exam, they might recommend some additional tests to get a clearer picture of what's going on.
Okay, what kind of tests? Can you give us some examples?
Of course. A pregnancy test is often one of the first tests they'll do, especially for women who are still in their childbearing years.
Right.
It's just a precaution to rule out pregnancy as a potential cause of the bleeding, even if it seems unlikely.
Makes sense. It's always better to be safe than sorry.
Exactly.
What other tests might they order?
Blood tests are also very common. They might check your blood count to see if you're anemic, which, as we talked about earlier, can happen with, prolonged or heavy bleeding. They might also check your thyroid hormone levels because thyroid problems can sometimes affect your menstrual cycle and cause abnormal bleeding.
Right. We talked about that in the last part. It's amazing how interconnected all these systems in our bodies are.
It really is. And depending on what they suspect might be going on, they might also order tests to check your hormone levels or even tests to see how well your blood clots. There are a lot of different possibilities.
So we've got pregnancy tests, we've got blood tests. What about imaging tests? I remember the Merck manuals mentioned ultrasounds as a possibility.
Yes, ultrasounds can be incredibly helpful in visualizing the reproductive organs. They use sound waves to create pictures of your uterus, ovaries, and fallopian tubes. It's a non-invasive and painless way to see if there's anything structurally going on that might be contributing to the bleeding, like fibroids, polyps, or cysts.
It's fascinating how technology allows us to peek inside our own bodies without any incisions or anything.
Yeah.
So let's say the ultrasound does show something suspicious, like one of those fibroids or polyps. What happens then?
Well, in that case, your doctor might recommend a procedure called a hysteroscopy or a sonohysterography. And these are ways to get an even closer, more detailed look inside the uterus.
Okay. Those sound a little intimidating, to be
I
honest.
know, they can sound a little scary,
Yeah.
but they're actually very common procedures, and they're usually done in an outpatient setting, meaning you don't have to stay overnight in the hospital.
Okay, that's good to know. So what actually happens during those procedures?
Okay, so for a hysteroscopy, they insert a thin lighted tube called a hysteroscope through your vagina and cervix into the uterus. And this allows them to directly visualize the lining of your uterus and look for any abnormalities. Sometimes they'll even take a small sample of tissue during the procedure, which is called a biopsy, to examine under a microscope.
That makes sense, especially if they're concerned about, something like pre-cancer or cancer.
Exactly. A biopsy is the most accurate way to determine if there are any cancerous cells present.
Got it.
And a sonohysterography is very similar to a hysteroscopy, but instead of using a lighted scope, they use saline solution and ultrasound to create those images of the inside of your uterus.
Wow, it's amazing how advanced medical technology has become.
Yeah.
Okay, so we've talked about all the potential tests and procedures, which can feel a bit overwhelming. But let's shift gears to the part I think we're all really interested in. Treatment. What are some of the ways abnormal bleeding can be addressed once they figure out, what's causing it?
Yeah. That's the ultimate goal, right? Find solutions, get back to feeling our best. The good news is that there's a whole range of treatment options available, and the specific treatment really just depends on the underlying cause of the bleeding.
So it's all about personalized care, figuring out what works best for each individual person.
Absolutely. If it's something simple like spotting from birth control pills, the doctor might just recommend adjusting the type of pill you're taking or tweaking the dosage.
Okay, that sounds pretty straightforward. But what if it's something more complex, like those fibroids or polyps we talked about?
Right. Well, if those are causing problems and impacting your quality of life, they might need to be surgically removed. But don't worry, there are minimally invasive surgical techniques available these days,
Okay.
like laparoscopic surgery and hysteroscopic surgery.
Huh.
And those can make the recovery process much easier.
That's good to hear. Minimally invasive procedures sound much less daunting than traditional open surgery.
They definitely are.
Okay, and what about those tricky hormones? If a hormonal imbalance is the root of the problem, what can be done?
Well, hormone therapy might be the answer.
Okay.
This could involve something like birth control pills or other medications that can help regulate your hormone levels and get things back on track.
So it sounds like there's a whole spectrum of treatment options available, from simple medication adjustments to more involved procedures. The important thing is to work closely with your healthcare provider to find the approach that best suits your individual needs and, preferences.
I couldn't agree more. It's all about finding the right fit for you. And remember, you're not alone in this. There are so many resources available, and your healthcare provider is there to guide you every step of the way.
That's such an important message, to feel empowered to ask questions, to advocate for yourself, and to find the best care possible.
Absolutely. It's your body, and you deserve to feel confident and informed when it comes to your health.
Wow, this has been such an incredible deep dive. Thank you so much for sharing your expertise in breaking down all of this, like, complex information in such a clear and accessible way.
It's been my absolute pleasure. I'm so passionate about empowering people with knowledge about their bodies, and I hope this deep dive has been really helpful for our listeners.
And to our listeners, we hope you found this exploration of abnormal vaginal bleeding informative and empowering. Remember, your body is amazing, and by understanding its signals and seeking appropriate care, you can really take charge of your reproductive health. Thanks for joining us on the Deep Dive.